One-page criminal complaint from the case titled The House of Horrors out of Oneida, Wisconsin. And we are moving straight on now to the part which are the medical records. So let's get straight into it. Don't forget, the initials MJG symbolize our victim's name. As she is a minor at the age of 14, her full name will not be disclosed for her privacy. Medical records. MJG's medical records from Children's Wisconsin Hospital. Dr. Sandeep Narang, medical doctor, indicate in part, for the purpose of this complaint, the names replaced with the initials, as I just mentioned. This is what it says. MJG initially presented to St. Vincent ED Emergency Department in Green Bay, Wisconsin via EMS on August 21st, 2025. She was transferred to CW for further care and subsequently admitted to the W4 PICU, which is, I think, isn't that the pediatric intensive care unit? PICU, pediatric intensive care unit. She was diagnosed with severe malnutrition and had signs of multi-organ dysfunction, including acute respiratory failure, cardiac dysfunction, severe acute hepatitis, pancreatitis, coagulopathy, hypothermia, hypoglycemia, and electrolyte derangements. She remained in the PICU until September 1st, when she was able to be transferred to W11. At 8:45 on August 22nd, 2025, MJG had a drop in her blood pressure and heart rate indicative of shock. She required significant resuscitation, including fluids and multiple rounds of epinephrine, as well as non-epinephrine drip. That's norepinephrine drip. A blood transfusion and electrolyte replacement was ordered. Initially evaluated by GI on August 22nd, 2025, and found to have acute severe hepatitis, most likely secondary to ischemic injury. On August 23rd, 2025, lipase elevation was suggestive of pancreatitis, most likely due to severe malnutrition and ischemia. Both the hepatitis and pancreatitis have improved over course of admission. Daily x-rays were initiated to monitor bowel obstruction, initially identified on abdominal CT. She was managed with bowel rest and decompression, and ultimately likely had a severe ileus from malnutrition as opposed to SBO. I'm taking just a quick pause. I know I said I was going to comment. I'm just going to read through. I will keep doing that. However, if you are somebody in the medical field, can you give your opinions down below? Give some insight. What do these things mean to you? And apologies in advance if I'm butchering these medical terms. I am not an expert in that field by any means, okay? So correct me where I need to be corrected. If you can shed light on more of these things that were disclosed about her, I'm just curious as to what they mean to you. I like to learn, so please educate me in the comments. Okay, back at it. Close monitoring was initiated on admission for refeeding syndrome. Magnesium and phosphorus were low on admission and required multiple replacements. MJG developed acute refeeding syndrome on August 23, 2025. She required numerous electrolyte replacements throughout the course of admission. As of September 15, 2025, MJG was requiring IV electrolyte repletion about every 3 days. MJG was initially evaluated by clinical nutrition on August 22, 2025. On subcutaneous fat exam, MJG was found to have little to no fat stores with visible ribs and spine and protruding hip bones. Micronutrient exam showed thin hair, which was sparse and patchy, pallor and dry flaky skin, and multiple sores on bony prominences. She was diagnosed with acute non-illness related severe malnutrition. TPN was initiated on August 22nd, 2025. I don't know what TPN is. NG feeds were initiated on August 28th, 2025, and were slowly advanced. TPN was discontinued, and oral feedings were initiated upon extubation on September 1st, 2025. So I think we're talking about she had a feeding tube. MJG expressed eagerness to continue to advance PO feedings and expressed enjoyment of food. MJG continues to eat at age-appropriate diet of 3 meals per day plus snacks and supplementation with Pediasure as needed. As of September 17, 2025, MJG was noted to be eating age-appropriate diet and fluid intake. Her physical findings were improved since admission, and this resolution was consistent with severe malnutrition and not some organic medical cause. APNP, NITS, discussed MJG's case with clinical nutrition via phone on September 4th, 2025, to discuss chronicity of malnutrition. Nutrition team stated that a lack of any height gain since last known data point would indicate significant malnutrition over an extended period of time, likely years. Severe pressure wounds and skin breakdown and lanugo, someone tell me what that is, were noted on admission. See photographs and physical exam section below. Wound care consulted and wound cares given. Wounds were noted to continue to heal throughout admission and did not recur. MJG was not noted to pick at her skin lesions during this extended hospitalization. Endocrinology was consulted on September 9th, 2025 to assist with vitamin D deficiency and bone health. Further documentation 25OH vitamin D level on August 28th was undetectably low, so she was started on vitamin D3, 1000 IU, on September 1st. On their evaluation, MJG reported no history of back, rib, or pelvis pain. Her presentation was consistent with osteoporosis, and given history of severe malnutrition, this is believed to be due to nutritional deficiencies. Ophthalmology was consulted on September 17, 2025, due to complaints of blurry vision, trouble seeing at a distance, and longer time needed transitioning from light to dark. A dilated exam and vision screening was performed. Temporal pallor was seen at the optic nerve head bilaterally. Exam findings were concerning for metabolic optic nerve neuropathy secondary to vitamin deficiency. Neuropsychological evaluation was performed on September 10, 2025. Many of MJG's cognitive abilities, working memory, attention, retrieval-based memory, language, and visual spatial skills were broadly age-appropriate, low average to average. MJG's processing speed was more variable, with some performances below age expectations, particularly for timed tasks that involved fine motor skills, for example, drawing. Per documentation based on evaluation findings, MJG is currently functioning broadly at her pre-injury level, example her cognitive baseline, although with somewhat more difficulty with processing speed, likely secondary to her recent medical complications in the context of severe malnutrition. MJG has been seeing psychology regularly while inpatient. Discussion occurred with psychology on September 9, 2025. Per psychologist, while she is not specifically assessing MJG for an eating disorder, she does not have concerns at this time that MJG suffers from disordered eating. She states that she is excited and eager to eat. Per documentation from several nursing notes and medical progress, MJG is able to sleep comfortably and is often noted to be sleeping during hospital medicine assessments. PRN melatonin 3 milligrams was prescribed, which she has been administered on occasion. MJG has stated that she picks at her skin at home as a habit and due to boredom. However, per search of notes, this is not a behavior that has been documented while hospitalized. Physical and occupational therapy. Initial OT evaluation occurred on August 26, 2025. MJG was found to have decreased ADL independence, decreased UE strength, and decreased activity tolerance. MJG's ADL, IADL participation, Lord, someone educate me on that as well, was limited by medical status limitations, decreased activity tolerance, fatigue, and weakness. Initial PT evaluation occurred on August 27, 2025. MJG was found to have decreased lower extremity strength, decreased tolerance for upright mobility, impaired transfers, and impaired gait. MJG received PT and OT 5 days per week. On August 28, 2025, the PT noted MJG required moderate assistance at her pelvis and trunk when standing. She was also noted to have bilateral knee flexion contractors and potentially bilateral hip flexion contractors based on posture in standing. On September 2nd, 2025, MJG was asked by OT how often MJG would normally shower. MJG replied whenever they would let me. When clarifying if PT knew if that was every other day or weekly, when clarifying if patient knew if that was every other day or weekly, patient said maybe weekly or monthly. I don't really know. Patient reports she was able to normally stand for her entire shower and wash her body independently in a walk-in shower. Patient also reports she could walk to and from the bathroom from her room, but would use door handles and the wall for support when walking. On this day, contractures were also noted to MJG's bilateral shoulders, and MJG reported, I don't know how long it has been that I can't move my arms all the way up. MJG required her assistants to press sink buttons to turn water on due to decreased UE strength to push button to activate sink. When asked by OT if she would like deodorant, MJG reported that she did not know what that was. MGG walked with PT on September 2nd, 2025, who noted a crouched gait due to contractors and distance limited by fatigue. MJG required a seated reset break of 2 minutes between walks, each 20 feet. On September 3rd, 2025, OT assisted MJG in the shower and required assistance with washing her hair because of her bilateral shoulder contractures and inability to move arms all the way up. Nursing notes. On August 25th, 2025, MJG was intermittently awake and uncomfortable. When awake, she was able to write on paper with marker and stated per nursing documentation, quote, "I'm hungry. I need a snack. Can I watch TV? I need to poop. I can't breathe." On August 26, 2025, MGG wrote on her whiteboard 3 different times asking when she could eat and wrote, "I'd like PD," indicating she likes Pediasure. On August 27th, 2025, father left the room to pick up takeout food, and upon return, he made jokes comments about being able to eat, as MJG wrote on her whiteboard, "Can I eat?" and, quote, "I'm hungry." On, oh God, on, because I think she had the feeding tube in by that point, so can't believe we brought real food back to the room to eat in front of her. On September 1st, 2025, MJG's RN documented that it had been approved for MJG to try to PO chocolate pudding. RN noted that MJG maintained appropriate O2 saturations, did not cough or sputter, and maintained conversation while eating and swallowed well. MJG then requested a second pudding, which RN obtained for MJG. While eating the second pudding, MJG expressed, "My dad will be so mad." When asked what he would be mad about, MJG replied, "He doesn't like when I eat this much." RN went to explain that once cleared by speech, MJG would have 3 meals per day and documented that MJG's eyes lit up as she started listing off all the options of food she could have over the course of the hospitalization. MJG inquired about pancakes, M&Ms, and tacos, and also stated she was looking forward to having vegetables. When RN said again that MJG would get 3 meals per day, she stated, "Oh, my dad is going to be so mad." She went on to say, quote, "He really doesn't like when I eat that much and the way that I get with food." When asked what she meant about the way she gets with food, MJG stated, "When I eat all of it, he also really doesn't like if I eat sweets." Moving on, they discussed the weight trends. On admission, MJG weighed 35 pounds, 7.9 ounces, and was in the less than 0.01 percentile. Her BMI was 8.68 kilograms, also in the less than 0.01 percentile. That is insane. Her height was estimated, knee height, at 53.63 inches. Again, this is less than 0.01 percentile. She had some initial weight gains between August 22nd and August 24th, which is likely representative of fluid. Her weight decreased slightly on August 25th, and since August 26th, MJG has showed steady overall weight gain with minor fluctuations. As of September 19th, 2025, MJG weighed 55 pounds, 7.1 ounces, still less than 0.01 percentile, representing an overall weight gain of about 19 pounds, 14.6 ounces. Good for her. Her standing height on September 19th was 54 inches, and her BMI had improved to 13.36, which was still less than 0.01%. Immunizations are not up to date. Per her record, she was due for HPV, meningococcal, and Tdap vaccines. This is now moving on to the impression. They state one, severe child neglect, nutritional, medical, dental, and physical. These types of neglect have had the following medical sequelae on MJG. Severe malnutrition with consistent circulatory shock and refeeding syndrome and multi-organ dysfunction on presentation. They've noted acute respiratory failure, now resolved with treatment, cardiac dysfunction, hepatitis, liver inflammation, pancreatitis, pancreas inflammation, hematologic dysfunction, macrocytic anemia, and leukopenia. She had insufficiency fractures of the vertebrae T9 through 11, an L11th rib, and severe osteoporosis and osteopenia. I am so sorry for butchering these medical terms. Dermatologic dysfunction, pressure sores, and thin dry skin. ophthalmologic dysfunction, optic nerve neuropathy secondary to vitamin deficiency, and dental dysfunction. She had diminished dental enamel and discoloration of dentition. 2. Concern for physical abuse. She had a forehead bruise on presentation. That's now resolved. Number 3. Concern for prior sexual abuse. Based on the paternal report, the STI testing negative. They go on to say MJG is a 14-year-old female with a reported past medical history of ADHD and autism who presented to Children's Wisconsin with severe malnourishment and numerous sequelae of malnourishment. Given the overall clinical picture with the information available at this time, MJG's presentation is consistent with the diagnosis of severe child neglect. Physical abuse cannot be safely ruled out at this point. Nutritional neglect and severe malnourishment. And for this part, they just kind of reiterated what I just read about her weight. And they do cover, though, the last known data point was in 2020 when MJG weighed 58 pounds and was around the 25th percentile for weight. This represents a loss of about 22 pounds since September 2020 at the age of 9. Her height had been measured on September 19, 2025, 45 inches. On physical exam, MJG was extremely emaciated with virtually no subcutaneous fat stores and visible bones, as well as other physical signs of severe malnutrition, including loss of and thinning of hair, lanugo and flaking skin, as well as numerous pressure sores over bony prominences. MJG was critically ill upon admission to the hospital with respiratory failure, requiring intubation and signs of circulatory shock. MJG developed acute refeeding syndrome and required electrolyte replacement for numerous days during her hospitalization. The development of acute refeeding syndrome is indicative of a prolonged period of inadequate caloric intake. According to the 2020 American Society for Perinatal and Enteral Nutrition Consensus Guidelines, refeeding syndrome is a potentially fatal condition that occurs in malnourished patients when nutrition is reintroduced. MJG had other findings consistent with severe malnutrition as well, including severe vitamin D deficiency and development of diffuse osteopenia on x-rays and DEXA scan with insufficiency fractures to the vertebrae of T9 through 11 and the left 11th rib, and vitamin B12 folate deficiency associated with anemia. She had evidence of multi-organ failure and had developed symptoms of tachycardia and edema concerning for further sequelae of vitamin and protein deficiencies. And her ophthalmologic exam shows concern for metabolic optic nerve neuropathy secondary to vitamin deficiency. These findings are all indicative of a prolonged period of malnutrition, with prolonged being most likely months to years, not days or weeks. On admission, the father, Walter, stated that MJG ate 3 meals per day and snacks, would sometimes vomit due to eating too fast, needed to be monitored while eating due to eating too fast, and would sometimes refuse meals due to her, quote, autism diagnosis. Additionally, he reported that MJG does not sleep at night, leading to an increased calorie consumption and inability to gain weight. He also reported that MJG had subcutaneous fat on her body 6 days prior to admission before becoming acutely ill, leading to weight loss. As stated above, the above findings are indicative of severe and prolonged malnutrition and are not consistent with the history father has provided about the frequency with which she ate prior to admission, or the rapid onset of weight loss leading to her physical exam findings on admission. MJG denies issues with vomiting prior to admission. Vomiting has also not been observed in the hospital setting outside of the acute period of food reintroduction. MJG was evaluated by speech therapy who reported no oral motor feeding or swallowing concerns. MJG has not been observed to refuse meals and has been excited to eat and appears to enjoy food. Furthermore, neuropsychological evaluation showed that MJG functions largely within her expected parameters for her age. MJG has been observed to sleep comfortably at night and occasionally requires melatonin for sleep initiation. After being medically stabilized, MJG began feeding orally and an age-appropriate diet on September 1st, 2025. MJG has done well with meeting her daily intake needs and has made steady weight gain during admission. Overall, she has gained about 19 pounds while hospitalized, evidence which supports her ability to gain weight when given adequate nutritional intake and not consistent with some organic medical disease process in MJG's body. This is further evidenced by her ability to gain weight normally during the first 9 years of her life, in which MJG demonstrated a relatively normal growth velocity and weight in the 25th percentile for age. Furthermore, father denied issues with resource needs or food insecurity, and food was available in the home per investigators. Overall, MJG's physical exam findings, hospital course, laboratory and imaging findings, development of numerous sequelae of malnourishment, and her ability to gain weight appropriately when being fed definitely outline a diagnosis of nutritional neglect resulting in severe malnutrition and its harmful sequelae. Medical neglect. The last known medical care MJG received was in September 2020 at the age of 9. Children MJG's age should be seen at least yearly for health maintenance and to monitor for overall growth and development. More pertinently, MJG's father reported that MJG had an autism diagnosis leading to, quote, self-harm behaviors, such as skin picking that required her to be monitored in her room and accompanied everywhere in the home. He also reported ongoing issues with food refusal and lack of sleep, leading to inability to gain weight. Father reports that he was going to switch MJG to his physician, but hadn't yet, despite the fact that he and other household members received care frequently and with relative ease. Father reported that the day of admission, MJG walked to the bathroom on her own, and that just 2 weeks prior, she was out in the yard with the dogs. MJG herself believes that she last played outside when she was 10 or 12 years old. She also reports that sometime before being hospitalized, she was no longer able to get to the bathroom on her own and that she needed to push herself up on furniture and hold onto objects and was no longer able to get up and walk. The father's description of MJG's strength and mobility is incongruent with her physical state when she arrived to the hospital, as well as her course in physical and occupational therapy, in which she has had to slowly progress in her stamina to walking and continues to need frequent breaks when ambulating or performing other tasks. MJG has multiple areas of contractures on her body, which are indicative of prolonged lack of normal movement and mobility. The American Academy of Pediatrics defines medical neglect as a caregiver's failure to provide or follow through with recommended health care for a child, resulting in or risking harm to the child. MJG's emaciation and overall physical appearance when admitted to the hospital was such that a reasonable caregiver would have had to know to seek medical attention. MJG's self-reported symptomology of progressive weakness and inability to perform activities of daily living, such as getting to the bathroom, should also have prompted caregivers to have her evaluated. MJG will require close follow-up once discharged and consistent medical care with multiple subspecialties to ensure her continued healing and monitor her growth and development. She is at high risk for further medical and psychological complications of severe malnutrition. She is also behind on immunizations and will need follow-up with routine dental care. It is recommended that MJG establish with a medical home who is able to meet her continued needs. Emotional, psychological neglect, abuse, and educational neglect. It has been reported from multiple sources, including MJG, that she was locked in her room from the outside for extended periods of time. She was reportedly monitored by a camera through which she communicated with other household members. MJG did not have unrestricted access to other parts of the home, including the bathroom where she was unaccompanied by another family member. MJG described that sometimes she would have to urinate on herself if she woke up in the middle of the night and had to use the bathroom, but was not able to get out because she was locked in her room. MJG has expressed that she has never completed hygiene tasks every day and only when she was allowed. There have been various explanations offered for why MJG had a lock on the door, including her, quote, self-harm behaviors of skin picking and her propensity to, quote, steal food, which is defined by the family as taking food from the kitchen or house without permission. MJG has reported picking as a behavior she has engaged in due to boredom and being fidgety. However, it has not been a behavior that has been documented in the hospital. MJG had to be reminded to not touch her breathing tube or NG tube and was compliant with this request. There had been no other concerns about or documentation of other self-harm behaviors while she has been inpatient. In her forensic interviews, MJG described love and fondness for her family members. This is understandable, as many abused and neglected children still love their maltreaters. However, particularly telling was that despite her love and fondness for her family members, MJG expressed a strong desire to not be locked in her room or be monitored with a camera. The American Academy of Pediatrics defines emotional or psychological maltreatment as acts of commission, doing something harmful, or omission, failing to do something necessary, by a caregiver that impairs a child's mental well being. Locking a child in a room from the outside poses many safety risks, including risk of injury in the case of a fire, and is not a recommended or appropriate intervention for, quote, skin picking behaviors. Additionally, poor hygiene predispossesses a child to wound infections, in that minor cuts and scrapes can become contaminated with dirt, sweat, and other debris, and predisposes children to other preventable infections, such as those obtained by the fecal, oral, or foodborne routes. MJG reportedly began virtual school in 2020 as a consequence of the COVID-19 pandemic and was initially enrolled in eAchieve. However, father reported he unenrolled MJG and began doing homeschooling. MJG stated in her forensic interview that she does, quote, normal fifth grade stuff for school, while according to her age, she should be in the ninth grade this fall. It is unclear what, if any, educational curriculum is being provided to MJG at home, raising concern for educational neglect. Educational neglect involves the failure of a parent or caregiver to enroll a child of mandatory school age in school or provide appropriate homeschooling or needed special educational skills or needed special educational training. Educational neglect can lead to the child failing to acquire basic life skills. Educational neglect can pose a serious threat to a child's physical and emotional well being and normal social and psychological development, particularly when the child has special education needs that are not met. Concern for physical abuse. On admission, MJG was noted to have a bruise to the forehead, which father presumed was from her banging her head against the wall as he had seen her do this before. MJG reported that she presumed it was from when she had a seizure at home prior to her hospital admission. MJG has not been observed to have had banging behaviors while hospitalized, and the history for the bruise is currently unclear, as well as what MJG's mobility capabilities were prior to hospitalization. While the bruise was over a bony prominence, the lack of a clear history in an otherwise vulnerable child raises concern for physical abuse, and further investigation is recommended. Now, that is the end of the full 41-page criminal complaint for this case out of Wisconsin. Um, I'm going to end it here. A lot of goes, I mean, it's insane reading through all that. Again, if you have insight or are able to comment when it comes to the medical terms, these diagnoses, the pediatric insight from here, that would be great. Please educate us all. If you know somebody, if you can't, but you know someone who can, nurses, specialists in pediatrics, please tag them. Um, I just think getting insight and the education, I like to hear from others, you know. I read the document, but I don't have any expertise in these areas. So please chime in. These people are horrible human beings. And honestly, the only thing that was done right here is that Walter called 911 and got her medical attention, which saved her life. That's unfortunately the majority of these cases, we don't see that. And we have kids passing away, it being covered up. So the teensy tiny bit of gratefulness here is that authorities were called and her life was saved, and hopefully she can do better, and she survived. And I can't she's gained 20 pounds. That's amazing. So I'm going to end this right here. That's the final part of the criminal complaint. I will have more updates. There was a hearing this week, and I've been working to have the body cam videos as well for this case. There's a lot more. I have more updates um in this case. So I'll be getting on it. It's a very complicated. There's a lot going on in this case. So thank you for listening. Again, something that just helps the channel that you can do if you so choose to. Like, share, subscribe, follow. Free to do. Helps the channel out, helps the algorithm, helps all the things. It's greatly appreciated. So I will see you in the next one. Thank you for tuning into the light. Don't forget, everything in the dark always, and it does always, come to the light.